Welcome back. Today in this video, friends, I will discuss you MCQs that are from hematology subject. So we will start. Question number 104. These MCQs are also from BOC book that I already discussed MCQs microbiology and biochemistry before. So now hematology section, some important MCQs I am going to share. Question number 104. A blood sample from a patient with a high titer cold agglutination analyzed at room temperature with an electronic particle counter would cause error in option A hemoglobin and MCV mean cell volume, option B MCHC and WBC, option C WBC and RBC, option D MCV and MCHC. And question number 104 answer is option D MCV and MCHC. Auto agglutination of anticoagulated blood can occur at room temperature in patients with cold agglutination, and MCV will be falsely elevated and RBC count falsely will decrease, resulting in elevated MCHC. And so the blood cell sample should be warmed to 37 degrees centigrade and rerun. Question number 105. When using an electronic cell counter, which of the following result can occur in the presence of cold agglutination? Electronic cell counter means hematology analyzer. Option A increased MCV and decreased RBC. Option B increased MCV and normal RBC. Option C decreased MCV and increased MCHC. Option D decreased MCV and decreased MCV and RBC. Question number 105 answer is option A increased MCV and decreased RBC. Actually, autoagglutination of anticoagulated blood can occur at room temperature as I discussed before in patients with a cold agglutination. The MCV will be falsely elevated and RBC count falsely will decrease and result in elevated MCHC. So again, if the patient is coming with cold or sample you are getting with cold agglutination, in that case blood sample should be warmed to 37 degrees centigrade and then we have to rerun. Question number 117. The principal confirmatory test for hereditary spherocytosis is option A osmotic fragility, option B sucrose hemolysis, option C heat instability test, and option D Calayor-Bateki. Answer is option A. The principal screening test for would be peripheral smear and RBC indices, but the confirmatory osmotic fragility is frequently a reference lab test. So osmotic fragility is confirmatory test for hereditary spherocytosis. Next question is question 118. A screening test for paroxysmal nocturnal hemoglobinuria is option A heat instability test, option B sucrose hemolysis, option C osmotic fragility, option D diethionate solubility. And answer is option B screening test for paroxysmal nocturnal hemoglobinuria. Mostly you will see PNH short form will be for this. The screening test is sucrose hemolysis. The sucrose hemolysis test is still sometimes used for screening. However, the most accurate measurement is immunophenotyping. Next question is question number 119. The Persian blue staining of peripheral blood identifies option A Howell-Jolly bodies, option B sidrotic granules, option C reticulocytes, option D basophilic stipplings, and the answer is option B sidrotic granules. Sidroblast and sidrocytes may be identified with pearl Persian blue iron stains. Next question is 120. Supravital staining is important for reticulocytes since the cells must be living in order to stain. The option A remaining RNA in the cell. Option B, iron before it precipitates. Option C, cell membrane before it dries out. Option D, denatured hemoglobin in the cell. Answer is option A, remaining RNA in the cell. Using supravital stain, residual ribosomal RNA is precipitated within the reticulocytes. Next question is question number 121. Which of the following is used for staining reticulocytes? Option A, Giemsa stain. Option B, Wright stain. Option C, new methylene blue. Option D, Persian blue. And the answer is option C. Methylene blue is used for staining reticulocytes, and using supravital stain, residual ribosomal RNA is precipitated within the reticulocytes. And why we will call this supravital stain? As you know, there is no fixation for this staining. Next question is question number 90. The most appropriate screening test for hemoglobin S is option A, Caliozure-Beteke. Option B, thionide solubility. Option C, osmotic fragility. And option D, sucrose hemolysis. And answer is option B. Go for question number 90. Dithionide solubility is the most appropriate screening test for hemoglobin S. The solubility test is a rapid test for hemoglobin S. This should not be used for screening newborns, need to be corrected in severe anemia, and is not specific for hemoglobin S, as there are other hemoglobins that will sickle. So the presence of hemoglobin S is confirmed by hemoglobin electrophoresis only. So this video is going to complete here. In future I will again share you some important MCQs either from hematology or from other subjects. Until that, we will complete this lecture here, and I will meet you as soon as possible with other lecture. If you want to learn about any other new topic, please do write in comment box also. Thank you so much.